Before we move on, I have one quick thing that I'd like to say, if that's okay.
Go ahead.
So I know that we're talking about racial trauma and mental health, but I think it's really important to also highlight the physical health things as well. So, when I think about this and I think about like physical health, one of the things that comes to mind for me is Black maternal health. We know right now with Black women who are experiencing pregnancy that they have the highest mortality rates. It's skyrocketed through the roof. And so I think about generationally how that impacts children. What is that going to be like for those children to grow up without their mothers? What is that going to be like? And then also thinking of pregnancy. If you're pregnant right now, and I know that Dr. Avon Harris has been, she has a 6-month-old. And so I think about a lot of, how we feel during our pregnancy, the things that occur in society while we're pregnant. Our children experience those things, in the womb. And so I think it's important to also think about generational trauma and maternal health. As we talk about mental health, those physical things are so very important too. So I just wanted to highlight that. And then Dr. Crum mentioned about disparities in schools. And so one of the tangential things that we know as fact is redlining is real. And so redlining, so that's one of the things, Dr. Crum said, we're not going to argue about these things, but I also feel like sometimes people want to argue about these things. And so redlining is a fact. It still happens. And so when redlining occurs, we know that those schools that are associated with higher SES communities get the textbooks, they get the tablets, they get the resources. So during this time of COVID, a lot of children were impacted because perhaps they couldn't afford Wi-Fi. Maybe Wi-Fi was not available at homes. Maybe there were no tablets. There are so many resource type things that that occurs through policies. And so we'll talk a little bit more about advocacy later, but those are just a couple of things that I wrote down that I really wanted to make sure to put in there.
Mm-hmm. That was